At 9:13 p.m., a Navy SEAL captain was wheeled into Cedar Valley Trauma Center with a crushed arm and 6 minutes before surgeons would cut it off forever. The trauma team was already prepped. The saw was ready. Then a young nurse walked through the door carrying a supply tray. And the dying soldier stopped everything. He pulled himself upright against every monitor screaming at him, locked his eyes on her face, and raised his uninjured hand in a full military salute. "Nightshade," his voice cracked. "I knew you were still alive." The tray hit the floor. Every doctor in that room turned to stare at the woman they'd been calling incompetent for 3 weeks straight. If this story already has you hooked, I want you to stay with me until the very last second, because what happens next will change how you see everything. Hit subscribe, drop a like, and leave a comment telling me what city or country you're watching from. I want to see how far this story travels. The first thing people noticed about Maya Bennett was that she apologized too much. Not in the way that earns sympathy, not the soft, self-deprecating kind that makes coworkers feel generous. Maya apologized the way someone does when they've been trained to make themselves small. "Sorry, excuse me," when she reached across a counter. "My mistake," before anyone had even finished explaining what went wrong. She held doors open for people who didn't say thank you and took the blame in handoff meetings when the error clearly belonged to someone else. The nurses on the day shift called her a pushover. The night shift just called her the new girl, even though she'd been there for 3 weeks and had stopped being new 2 weeks ago. Cedar Valley Trauma Center sat on the eastern edge of Doral, a mid-sized city in the kind of geography that exists between major destinations, close enough to a military installation to see helicopters most mornings, far enough from everything else that the hospital operated as though it were the last outpost of organized medicine before the wilderness. It had 412 beds, 2 trauma bays, 1 helipad that needed resurfacing, and a hierarchy so rigid it might as well have been printed on the walls. Maya had arrived in mid-October with a transfer request, 2 letters of recommendation from physicians who no longer worked anywhere the staff could easily check, and a resume that listed experience in austere medical environments, which the hiring coordinator had read as rural clinics. She wore her dark hair pulled back tight enough to look deliberate, said little during her orientation, and asked questions only when the answer wasn't already printed somewhere. The charge nurse on her floor, Donna Reyes, had pegged her as competent but quiet, which in a trauma ward meant you either got walked over or got ignored, and sometimes both on the same shift. Dr. Adrian Cole was neither of those things. He was the kind of man who'd been told he was brilliant for so long that he'd stopped being able to distinguish between brilliance and volume. At 44, he had the posture of someone who'd learned early that height was leverage, and he used it. He was Cedar Valley's trauma director, a title he mentioned in roughly every third conversation, and he had a habit of arriving in the middle of other people's decisions to correct them loudly and then walk away before the damage could be assessed. He didn't dislike Maya specifically. He disliked nurses who didn't pivot fast enough when he entered a room, and Maya, who had learned to move on her own rhythm, had already irritated him twice in 3 weeks without knowing it. The night of October 22nd started like most others. Maya was midway through a medication reconciliation when the radio at the nurse's station crackled with incoming trauma traffic. She heard the paramedic's voice cut through static. Male patient, mid-30s, crush injury to the left upper extremity, suspected vascular compromise, ETA 4 minutes, and set down her clipboard. Donna was already moving. 2 of the trauma nurses were pulling supplies. Maya fell in without being told, reading the cart setup and filling in the gaps the way she always did, quietly and without announcement. She didn't know yet who was coming in. The ambulance bay doors opened at 9:16 p.m., and the gurney came through hard and fast. Maya caught her first look at the patient from across the room. A man with a face that had been through things, angular and weathered in a way that had nothing to do with age. His left arm was wrapped in field dressings that someone had applied well, better than standard paramedic wrap, which she noticed. His right hand had a fist around the gurney rail, and he was conscious, which, given the blood pressure readout the paramedic was calling out, was something close to remarkable. She moved toward the supply station and started pulling what the team would need. The trauma bay came alive around her with the specific organized noise of people who'd done this many times. Dr. Cole swept in through the secondary door wearing the expression he reserved for cases that would look good in an incident report, already speaking before he'd fully assessed the patient. The imaging tech was positioning. One of the junior residents, a young man named Dr. Harlan Voss, who had the specific anxious energy of someone who knew more than he'd been trusted to show, was at the patient's left side, gently unwrapping the field dressing with gloved hands. Maya watched from 3 feet back, reading the room. What she saw in the arm when the dressing came off made something tighten behind her sternum. The limb didn't look dead. That was the thing. Crush injuries that had crossed the point of salvage looked a specific way. The tissue color went wrong, the swelling pattern changed. There was a visual language to it that took years to learn and even longer to trust. This arm didn't read that way. It was bad. The swelling was significant, the bruising deep and already modeling up toward the shoulder, and there was obvious structural damage. But the discoloration wasn't complete. There was something else going on, something about the distribution of the injury that didn't match a clean mechanical crush. She almost said something. Instead, she handed a sterile field pack to Donna and kept watching. The patient's eyes had been moving since he came in, not the unfocused drift of someone in shock, but deliberate, tracking. He'd been taking in the room. When his gaze landed on Maya, it stopped. She felt it before she looked up. When she did, his expression did something complicated. His lips parted. His right hand released the gurney rail. Nightshade. It came out quiet enough that only the people closest to him caught it. Maya went still. I knew you were still alive. I was trying to push himself upright, and the monitors immediately started protesting, 2 different alarms triggering at once, a nurse grabbing his shoulder to keep him down. But he got his right arm up, full extension, a salute so precise it looked like muscle memory, which it was. The supply tray left Maya's hands without her deciding to drop it. The sound hit the floor and everything in the room fractured for 1 full second. Heads turning, hands pausing mid-task. Cole looking up from the imaging readout with the specific irritation of someone whose workflow had been interrupted. What? Donna started. Maya had already closed her expression. Whatever had crossed her face in that half-second was gone, smoothed back into the careful neutral she wore like a second skin. She bent and started collecting items from the floor. Her hands were steady. She kept her eyes down. He's confused, she said. Blood pressure's been low. I'm not confused. The patient's voice had more steel in it than his vitals had any right to support. I know exactly who you are. I've been looking for you for 2 years. Cole stepped toward the gurney with the deliberate energy of a man reclaiming a room. Sir, I need you to lie back and stop moving. You have a serious vascular injury, and we are going to need to make some fast decisions about what decisions. It wasn't a question. There's significant damage to your left arm. Based on what we're seeing, the tissue viability window is extremely narrow, and our assessment is you're talking about amputation. We're talking about what's necessary to preserve your life. The man, the patient, looked at Cole for exactly 3 seconds. Then he looked back at Maya, who had straightened and was standing 2 feet from the wall with the retrieved supplies held in front of her like a reason to be somewhere else. Maya. He said the name differently this time, not the call sign, her actual name, or at least the one she'd given this hospital. Tell them. I'm a floor nurse, she said. I don't have trauma privileges here. That's not what I asked. Cole turned to look at her with an expression she recognized. Not curiosity, not confusion, but the specific sharpened attention of someone deciding whether to be annoyed or dismissive and landing on both. You know this patient? No, Maya said. She's lying. The patient said it without heat, just factually, the way someone reports a weather condition. Her name isn't Maya Bennett, or it is now, but she wasn't always Maya Bennett. 2 years ago, in a location I can't name in a room like this woman performed a procedure on my left shoulder while we were taking fire from 3 positions, and she did it with equipment that came out of a cargo pocket. He paused to breathe, and the effort of the sentence showed in his face. She saved my arm then too, which is why I am asking her to look at this one before you cut it off. The room had gone the specific quiet of people who are pretending to work while absorbing something they don't know how to categorize. Cole looked at Maya. Maya looked at the patient's arm. She looked at it the way she'd been trained not to look at things in places where looking too long revealed too much. But something in the injury's pattern had snagged on her, and it wouldn't release, and she was already doing the math without deciding to. I don't have authorization to examine the patient, she said. Then I authorize you. The patient's voice, flat and certain. My name is Captain Ethan Cross. I'm on active duty, and I have the right to designate who participates in my care. I'm designating you. That's not how this hospital works, Cole said. Captain. Maya spoke before Cole could continue, and something in her tone made him stop. Not because it was loud, it was the opposite of loud, but it carried a quality that didn't belong to a floor nurse 3 weeks into a new position. Can you feel anything below the elbow? Cross's eyes focused. Pressure. Some sensation in 2 fingers. Left side or right side of the hand. Thumb and index. She looked at the arm again. Harlan Voss was still near the distal end of the extremity, and she watched his face as he worked, reading his assessment through his expression. He was good. He was picking up on something. She could see it in the slight tension around his eyes, the way his hands had slowed. Dr. Voss, she said not loudly. Radial pulse? Voss looked up at her with the uncertain expression of a junior resident being directly addressed by a floor nurse during an attending's case. He glanced at Cole. Cole said nothing, just watched. Absent, Voss said after a beat. Consistent with what we saw on the scan. Is there a companion vein? Another pause, he checked. Some flow, reduced. Maya set the supplies down on the counter behind her, deliberately, not because she was dropping them. She was freeing her hands. The injury pattern doesn't look like clean crush, she said. She was speaking to Voss, which gave Cole the option of ignoring her, which he would take or wouldn't, but she wasn't going to direct this at him. The distribution, the way the bruising runs proximal from the primary impact site, that's not settling. That's tracking along something. There's significant structural damage, Cole said, his voice carrying the practiced flatness of a man who has decided to be patient for exactly 2 more sentences. The imaging, what was the mechanism? She asked it toward Cross. Machinery, he said. Equipment came down on a diagonal. Left shoulder and upper arm took initial contact. She turned back to the arm. If the primary force was diagonal and the structural damage is mid-shaft, the vascular compromise might not be from the crush. It might be from a secondary displacement. Something shifted after impact and it's compressing the vessel. Voss was very still. Cole said, You're a floor nurse. I know what I am. Then you should know that vascular assessment is not within your scope. I'm not assessing. She looked at him directly for the first time in the conversation. I'm telling you what I see and you can do whatever you want with it. The silence that followed lasted approximately 5 seconds, which in a trauma bay is a long time. Cross spoke into it. She's right. He said it quietly, not triumphantly. That's how it happened. The equipment came down at an angle. Secondary impact from the support structure caught my upper arm after the main hit. Cole looked at the patient, at the imaging readout, at Voss, who had the careful expression of someone who did not want to be in this room for whatever was about to happen. We proceed with the current plan, Cole said. We are inside the viability window, and every minute we spend discussing, give me 3 minutes. Maya said it clearly, without apology, without hedging. The version of herself she'd been carefully keeping underneath the surface of Maya Bennett, floor nurse, was showing through at the edges, and she could feel it, and she didn't pull it back this time. 3 minutes, she said, and I'll show you whether there's something to find. Cole stared at her. You're a nurse, he said, not a battlefield surgeon. No. She moved toward the patient's left side, not waiting for permission, because she already had it from the only person in the room whose arm it was. I'm not. She pulled on a fresh pair of gloves, and her hands found the injury with a directness that made Voss step back half a step without meaning to. She wasn't rough. She wasn't performing. She worked the way she'd been trained to work in environments where there was no OR prep, no anesthesiologist standing by, no margin for anything except getting it right. Her fingers moved along the proximal aspect of the arm, reading the tissue beneath the skin. The way you learn to read things when instruments aren't always available. She found the swelling pattern. She traced the bruising. She pressed gently at a specific point just below the shoulder where the discoloration had a slightly different quality. Darker, more concentrated, the kind that happens when bleeding is contained rather than dispersed. Cross hissed through his teeth. Sorry, she said, and this time it wasn't the reflexive apology of someone making themselves small. It was the real kind. Find it, he said. She did. It was there. A distinct resistance beneath the tissue, a tension that didn't belong, running perpendicular to the primary injury axis. Not a fracture fragment, or not only that. Something structural had displaced and was sitting against the vessel like a hand pressing on a hose. There, she said, not to Cole, not to anyone specific, just out loud because naming it mattered. Voss was leaning in despite himself. What is that? Displaced bone fragment, maybe 2 centimeters proximal to the primary impact site. It's not in the main imaging view because it's subtle and the surrounding swelling is masking the outline. She looked at Cole, who had not moved from where he was standing. If that's what's causing the vascular compromise, and I believe it is, the procedure you're about to perform is unnecessary. Cole's jaw worked. You believe, he said. Yes. Based on a manual exam, and the injury mechanism, and the sensation distribution, and the companion vein flow that Dr. Voss confirmed. She waited. I'm not asking you to take my word for it. I'm asking you to get a targeted ultrasound of the proximal aspect before you proceed. 5 minutes. If I'm wrong, you've lost 5 minutes, and I'll accept whatever consequences you think are appropriate. The word consequences landed in the air between them and hung there. Cole looked at the patient. Cross was watching him with the flat patience of someone who has waited out worse situations than a hospital standoff and knows the difference between a man who's thinking and a man who's already decided. Run the ultrasound, Cole said finally. He made it sound like his idea. Voss, get imaging back in here. Voss was already moving. Maya stepped back from the patient's side. Her gloves were still on. She didn't take them off. Cross looked at her. You never left, he said quietly, low enough that it was between them. Did you? She didn't answer that. Nightshade, don't. Her voice was flat and sure and had nothing left of apology in it. Right now I need you to hold still. He held still. The ultrasound tech came back in 3 minutes, which at Cedar Valley was essentially a speed record. The room reorganized itself around the process. Cole positioned himself where he could see the screen, and Maya watched his face rather than the screen because she already knew what the screen was going to show. She watched him see it. The moment the image resolved, the specific way his expression moved, the almost imperceptible tightening around his eyes before his face reset to neutral, told her everything. He saw it. The fragment. The position. The vessel compressed against it like a wire under tension. The companion vein flowing because the blockage was mechanical, not biological. The tissue beyond the obstruction that had not yet crossed the point of no return. There was a long pause. Adjust the imaging protocol, Cole said to the tech, in a voice with very little in it. Voss was looking at Maya with an expression she recognized from other places. Not quite awe, not quite calculation, something that lived between them. He opened his mouth. Don't, she said quietly. Same word she'd used with Cross, same tone. He closed it. The room began preparing for a different kind of intervention, and Maya pulled off her gloves and walked back toward the counter where she'd set down her supplies. Her hands were completely steady. Her pulse was not, but nobody could see that. She began reordering the supplies that had spilled when she dropped the tray. Behind her, Cross was watching her back. 2 years, he said. I looked everywhere. She kept her hands moving. You're going to need to be quiet now, Captain. Her voice didn't shake. They're going to take care of your arm. Maya, I know. She set down the last item. I know why you're here. She turned to look at him one more time, and whatever passed between them in that look was not the kind of thing that gets recorded in a hospital chart. Then she picked up her clipboard from where she'd left it before all of this started, walked to the workstation in the corner of the bay, and began documenting the medication reconciliation she'd been doing when the call came in. Like nothing had happened, like she was exactly who she'd said she was when she walked through Cedar Valley's doors 3 weeks ago. The trauma team worked around her. Cole's voice was giving instructions in the clipped, efficient register of a man performing competence. Voss was assisting with the precision of someone who'd decided to pay very close attention to this particular case. The imaging was repositioned. The plan had changed. Maya typed. Her reflection sat in the dark surface of the computer screen, faint and inverted, and she didn't look at it. Somewhere in the room, Captain Ethan Cross was watching her, and she could feel it the way you feel the change in pressure before weather rolls in. Not painful, just impossible to ignore. He'd found her. After 2 years of whatever it was he'd been doing, he had walked through her hospital on a gurney with a crushed arm and the word that nobody here was supposed to know. and he'd said it out loud in a room full of people. Nightshade. She'd spent 2 years making sure nobody knew that name. She had 4 hours left on this shift, and she was going to finish them, and then she was going to go home and figure out what came next. Except she already knew, somewhere below where decisions get made, that the thing she'd been out running had arrived. And it had arrived wearing a uniform and a salute, and it was going to ask her questions she'd stopped being able to answer the night she walked away from everything she'd been. The monitors beeped. The team worked. Cole's voice moved through instructions with the authority of a man who had not just been corrected by a floor nurse in front of his entire team, except that he had been, and every person in that room knew it, and that particular debt doesn't disappear because nobody says it out loud. Maya kept typing. Her hands had stopped shaking by the time she reached the third medication entry. The arm was going to be saved. She knew it the way she knew most things she wasn't supposed to know. Not because someone had told her, but because she'd already done the math, and the math only went one direction. What she didn't know yet was what Captain Ethan Cross intended to say to her once this was over. But the look on his face when he'd said her name, both names, the real one and the one that wasn't a name, the one that had been a designation and became something else over the course of a mission that nobody officially documented. That look had not been simple. It had been the look of a man who had come a long way, and who did not intend to leave without finishing the conversation she'd been refusing to have for 2 years. Down the corridor, past the double doors, past the elevator bank, and the family waiting area, and the vending machine that took your money, and sometimes gave you something back. The night went on the way hospital nights do. Continuous, indifferent, full of people in trouble, and people trying to help them, and the vast, complicated distance between those two things. Maya Bennett typed her medication reconciliation. Somewhere in her chest, in the place where Nightshade used to live, something shifted that she couldn't shift back. The shift ended at 1 a.m., and Maya was still at her workstation. Not because she had documentation left to finish, she'd cleared her chart 2 hours ago, cross-referenced everything twice, initialed the handoff notes in the precise small print that her coworkers had started to notice, because it was the handwriting of someone who'd learned to document in conditions where the record might be the only thing that survived. She was still there because leaving meant walking past the room where they'd moved Ethan Cross after the intervention, and she hadn't decided yet whether she was going to do that. The procedure had gone the way she'd known it would. Cole had performed the decompression himself, of course he had, with Voss assisting and an OR nurse named Petra, who'd been at Cedar Valley for 11 years and had the calm of someone who'd watched 100 cases that were supposed to go one way and went another. The fragment had been exactly where Maya said it was. The vessel had been exactly as compromised as she'd described. When the pressure released and blood flow returned to the distal arm, somebody in the room, she didn't see who, exhaled loud enough to be audible from 3 feet away. Cross's fingers had moved. She hadn't been in the room for that part. She'd gone back to the floor. But Donna had found her 20 minutes later at the medication cart and told her, watching Maya's face while she said it, looking for something. Maya had nodded and said good and gone back to pulling the 11 p.m. medications. Donna had stood there for a second longer than was necessary, then walked away without saying anything else. Now the ward was in its overnight rhythm, the specific low hum of a hospital at 1 a.m., where the busy work of daytime had compressed into the focused labor of keeping people stable through the dark hours. Maya pulled on her jacket, picked up her bag, and walked toward the elevator. She took the long route. She told herself it was because the vending machine was on that side of the building and she hadn't eaten since 4 in the afternoon, which was true. She fed $3 into the machine, got back a granola bar and 2 quarters change, and stood eating it in the hallway outside the vending alcove with the specific numb tiredness of someone running on task completion rather than actual energy. The door to room 114 was 20 feet away. She stood there for a while eating the granola bar, looking at the door, not going to it. Then the door opened and Ethan Cross was sitting up in the bed with his left arm immobilized and his right hand holding the call button he had apparently decided not to press, looking directly at the hallway like he'd known she was there. Maybe he had. She'd trained with people who could track footsteps through 2 walls. It wasn't impossible. "You should be asleep," she said from the doorway. "You should have left an hour ago." She finished the last of the granola bar and folded the wrapper into a precise rectangle, the way she always did, a habit from places where leaving trash was a liability. She put it in her jacket pocket. "Your arm," she said. "Any sensation changes since the procedure?" Don't do that. I'm asking a clinical question. You're stalling. He shifted against the pillows, which cost him. She saw the brief compression of his mouth, the controlled exhale. The arm was going to hurt for a long time, even after this. Sit down, Maya. I'm not your nurse tonight. I know. Sit down anyway. She looked down the corridor, empty, the overnight tech at the far station with his back to them. She came into the room and sat in the chair beside the bed, not because he'd asked her to, but because standing in a doorway was worse. It looked like indecision. She'd spent 2 years trying not to look like anything. How did you find me? She asked. Accidentally, he said, which she hadn't expected. I wasn't looking here. I was in Doral for a debrief at Kelman. That's the installation 20 miles out. And the equipment failure happened during a logistics exercise. Wrong place. He paused. Or right place, depending on how you look at it. And you recognized me. The second they brought me in. He said it simply, without drama. I've been looking at your face in my memory for 2 years. I'd know you in a crowd from 40 meters. Something moved in her chest that she didn't have a name for. She didn't pursue it. You shouldn't have said it out loud, she said, in the trauma bay, with all those people. I know. That name, I know, Maya. I know what I did. He looked at her steadily, not apologetic exactly, but aware. I saw you, and I said the word before I thought about it. That hasn't happened to me since I was 22 and green, and I don't have a good explanation for it. She believed him, which made it worse in some ways and better in others. Nobody here knows what it means, she said. No, but Cole's going to ask. Let him ask. He already pulled your personnel file. Cross watched her face when he said it. While you were on the floor, Petra heard him on the phone with HR about 40 minutes after the procedure. Maya was quiet for a moment. The personnel file that existed for Maya Bennett was clean. It had to be. It had been constructed by people whose entire job was constructing things that could withstand scrutiny. But it was a construction, and constructions had seams, and a determined person looking for the seams in the right light could sometimes find them. He's going to come at you tomorrow, Cross said. Whatever he decides he's going to do about what happened tonight, he's going to do it through the file. I know how it works. Do you want me to make a call? No? She said it fast enough that he registered it, and she made herself slow down. No, thank you. I'll handle it. He studied her. You're not going to run, he said. It wasn't a question. I just started here. That's not what I mean. She looked at her hands. She'd taken off the gloves hours ago, but she could still feel the texture of the procedure in her palms, the resistance of tissue, the particular geography of an injury she'd had to read by touch in a room with too many people watching. It was a familiar feeling. It was the feeling she'd spent 2 years trying to put somewhere it didn't take up so much space. I'm not going to run, she said. He nodded, once. They sat with that for a moment, and the hospital went on around them in its low nighttime way, and outside the window there was the distant sound of a helicopter making its approach to the helipad, which meant another incoming case, which meant the night wasn't finished yet. There's something I need to tell you, Cross said. About Donovan. She stood up. Not tonight. Her voice came out flat, not angry, just sealed. Whatever you came here to say about Donovan, it's going to have to wait. Maya, you've got a serious vascular injury that was repaired 4 hours ago, and you need to sleep. And I need to... She stopped, reorganized. I need to get home. Will you come back tomorrow? She looked at him. The question was simple and the answer was complicated, and she knew which one he was really asking, which wasn't about whether she'd show up to the hospital where she worked. Yes, she said. She walked out before he could say anything else. The morning arrived the way mornings do after nights that didn't really end. Not a clean break, but a continuation of the same long thread, just with more light. Maya was back at Cedar Valley by 6:45 for the 7 a.m. shift, and she knew something was off before she reached the nurses' station, because of the way Donna looked at her. Donna Reyes had a face that operated on a delay. She processed things internally for 2 or 3 seconds before her expression caught up. Maya had learned this in 3 weeks of working alongside her. Right now the delay was longer than usual, which meant whatever Donna had learned in the past several hours was something that was still being processed. Morning, Maya said. HR called, Donna said. She said it to the counter surface, not to Maya's face, which was another tell. They want to see you at 8. Okay. Do you know what it's about? I have a guess. Donna finally looked up. She was a woman in her mid-50s with 22 years on this floor, and the particular brand of tired competence that comes from 2 decades of caring about things in an institution that doesn't always care back. She looked at Maya for a moment like she was trying to figure out the right question to ask. Last night, Donna said carefully. The SEAL captain. Yes. You knew what you were looking at. Maya straightened a stack of papers on the counter that didn't need straightening. I've seen crush injuries before. In what context? It wasn't an accusatory question. It was a genuine one, delivered in the tone of someone who was trying to understand something and was willing to hear an uncomfortable answer. I worked in austere environments, Maya said, rural and remote. You don't always have the equipment you'd want, so you learn to work with your hands and your eyes. All of that was true. None of it was complete. Donna sat with it for a moment. The fragment, she said. The position you identified. Voss looked it up this morning. The diagnostic approach you used. The manual palpation protocol. He says it's a field assessment technique used by combat medics in forward operating environments. Voss talks a lot for a junior resident. He also does his homework. Donna paused. He's not trying to make trouble. He's trying to understand how a floor nurse knew something that he didn't learn in 4 years of medical school. Maya picked up her assignment sheet. I should get to my patients, she said. She felt Donna watching her as she walked away. The morning floor was manageable. 4 patients in her section, 2 post-surgical, 1 a chest infection complicated by a history that required careful medication management. 1, a 73-year-old named Mr. Gaston, who had come in 3 nights ago with a fall injury and had decided that Maya was the only person in the hospital worth talking to, a decision he expressed by calling for her every 45 minutes and by having an opinion about everything she did. You look tired, he told her at 7:15 when she came in to check his vitals. I'm fine, Mr. Gaston. You've got circles under your eyes and you're moving like someone whose mind is somewhere else. I was a high school coach for 30 years. I can read people. Blood pressure's good, she said, noting it. The soldier downstairs, he said. Word gets around in a place like this. Donna told me a nurse figured out his arm. She looked at him. She didn't say your name, he added, but she didn't have to. Maya clipped his chart. You should try to rest this morning. The physical therapist is coming at 10. I'm resting fine. My point is, I know what your point is. He stopped. Something in her tone, not harsh, just direct in a way she didn't usually deploy on patients, made him readjust. He settled back against his pillow. All right, he said more quietly. All right then. She finished the vitals check and left. At 8 o'clock, she walked into the HR office on the 3rd floor and found that Cole was already there. She hadn't expected that, and she took an extra half-second to process it before she sat down across from the HR coordinator, a thin-faced woman named Judith, who had the well-practiced neutrality of someone who spent her days in rooms where things went sideways. Cole was in the chair to the left of Judith's desk, not behind it, a deliberate positioning that said he was a participant rather than an authority, which was the kind of careful institutional move that people like Cole made when they wanted something without appearing to want it. Thank you for coming in, Judith said. This is just a conversation, nothing formal at this stage. Of course, Maya said. Dr. Cole raised some questions this morning about an incident during last night's trauma response, specifically regarding your involvement in the assessment of a patient outside your designated role. She waited. I provided an observation, Maya said. I didn't perform a procedure. You performed a manual examination of the patient, Cole said. His voice was controlled. She'd expected cold, but it was something more careful than cold. He was angry, and he was managing it, which meant he was also strategic, which meant this conversation was going somewhere specific. You directed imaging protocol. You influenced the course of treatment. I expressed a concern, and Dr. Voss ran appropriate imaging to evaluate it. The attending made all clinical decisions. You told me to get a targeted ultrasound. I suggested it. You ordered it. The distinction hung in the air. Cole leaned forward slightly. Ms. Bennett, I want to understand something. You've been on this floor for 3 weeks. Your file indicates some experience in rural healthcare settings, which is vague enough that it tells me very little. Last night you demonstrated knowledge and a clinical approach that is not consistent with that background. He paused. I'm asking you directly and professionally to explain the discrepancy." Maya looked at him for a moment. He was smart. She'd known that from the first time she'd seen him work. The arrogance covered something real, which made him more dangerous than the purely incompetent variety. "I've been in situations where I had to learn quickly," she said. "What situations?" "The positions are a matter of record. I pulled your record." He said it without breaking eye contact. "Your employment history has some gaps that HR was not able to immediately clarify." "Gaps," she repeated. 2 years, roughly, between your last documented position and your application here." Judith looked up from her notepad with an expression that said this was slightly more aggressive than the tone she'd been briefed to expect. "Dr. Cole," Maya said, and she made her voice very even. "If you have concerns about my licensure, you can submit them to the state board and they'll review my credentials. If you have concerns about my conduct last night, the patient's attending signed off on the outcome and the patient is alive with his arm intact." She stood up. "If there's a formal process you'd like to initiate, I'm happy to participate in it. But I'm not going to sit here and explain myself informally while my patients are on the floor waiting for their 8 o'clock medications." She looked at Judith. "Is there a formal process being initiated?" Judith glanced at Cole. "Not at this stage." "Then I'll go back to my shift." She walked out. Her hands were shaking by the time she reached the stairwell, and she made herself stop on the landing between the second and third floors and press her back against the wall, and just breathe for a moment. Not because the conversation had gone badly, it had gone almost exactly as she'd anticipated, but anticipating something and living through it were different physical experiences, and the adrenaline needed somewhere to go. She breathed through it, counted her exhales. An old technique, one of the first things she'd ever been taught, back when she was someone else entirely. Then she pushed off the wall and went back down to her floor. Voss found her at lunchtime. He appeared at the break room door while she was eating a sandwich she didn't particularly want, and he stood in the doorway for a second with the particular hesitation of a junior resident who knows he's about to have a conversation that might not go the way he'd like. "You have a minute?" he asked. "I have 7, she said. "Sit or stand, doesn't matter." He sat. He was young, 28, maybe 29, with the kind of face that still registered too much, which in a few years would be an asset, and right now was just a liability. He hadn't figured out how to manage. He put his hands on the table and looked at them. "I wanted to say," he started. "You don't have to say anything." "No, He looked up. "Last night, I knew something was wrong with the assessment. I could feel it, and I didn't say anything." She took a bite of her sandwich, waited. "I should have pushed back on Cole's read," he said. "I'm a resident. I'm not supposed to just go along with whatever the attending says when something looks off." He stopped. "I went along with it." "You checked the companion vein when I asked," she said. "Because you asked. I didn't initiate it." "Voss," she set down the sandwich, "you did what a first-year resident does in a room with an attending who has 30 more pounds and 20 more years than you. You're going to be in that situation again, and next time you'll push a little harder, and then a little harder than that, until eventually you're the person doing the pushing without needing anyone to ask you to." She picked up the sandwich again. "That's not a failure. That's a progression." He was quiet for a moment. "Who are you?" he asked. Not in the accusatory way Cole had been working toward, just directly, genuinely. "Maya Bennett," she said, "floor nurse." "That's not—" He stopped himself, reconsidered. Okay, she agreed. He stood to go, then stopped. "Captain Cross asked for you this morning, specifically requested that you be the nurse assigned to his room. I'm not on his unit." "I know." Cole denied the request. He paused in the doorway. "I thought you should know he made it." He left. Maya sat with the sandwich for a while. Outside the break room window, the afternoon had the specific quality of late October light, low and flat, going golden in a way that didn't warm anything. She thought about Cross lying in that bed making a formal request that he knew would be denied, not because he thought it would work, but because it would go into the record that he'd asked. He was building something. She didn't know yet exactly what. She found out 3 hours later. She was coming out of Mr. Gaston's room. He'd escalated from 45-minute calls to 30, which the PT visit had apparently done nothing to reduce, when she saw the 2 men in the hallway outside the nurse's station. They weren't in uniform exactly, They wore clothes that functioned as a middle state between civilian and military, the specific cut and posture that said these were not people accustomed to standing around in hallways. One was tall and had the particular economy of movement that comes from a long time spent in places where unnecessary motion is a liability. The other was shorter and was carrying a folder. They were talking to Donna. Donna was pointing in Maya's direction. Maya stopped walking. The taller man turned. He looked at her across 30 feet of corridor with an expression that was not quite recognition and not quite assessment, something between the two, like someone checking a photograph against a face. He said something to Donna. Donna nodded. He walked toward Maya. "Ms. Bennett," he said when he reached her. He said the name with careful neutrality, like he knew it was provisional. "My name is Supervisory Agent Darlene Marsh." He held out credentials. Not hospital administration, not local law enforcement, something that sat in a different category entirely, from an agency whose name she read on the ID and which she had known, in a previous version of her life, by a different designation. "Do you have somewhere private we can talk?" She looked at the folder in his partner's hands. She looked at Marsh. "Yes," she said. Her voice was steady. Her pulse was doing something it had no business doing in a hospital corridor. They walked together toward the consultation room at the end of the hall, and as they passed the nurse's station, she caught Donna's eye for just a second, and Donna's face had finally caught up to what it was processing. And what it was processing looked a great deal like the specific expression of someone who has just realized that the quiet nurse they thought they understood is standing in a completely different story than the one they'd been told. The door to the consultation room clicked shut behind them. Maya sat down across the table from Marsh and his partner. The folder went on the table between them, and Marsh looked at her for a moment before he opened it. "We've been trying to locate you," he said, "for a significant amount of time." "I know," she said. "Then you know this conversation was coming." "I knew something was coming." She looked at the folder. "I didn't know it would look exactly like this." Marsh opened it. The photograph on top was her, not Maya Bennett. The other one, taken in a different country, in different light, in the kind of circumstances that don't get described in civilian paperwork. She looked younger in the photograph, or maybe not younger exactly, but less organized, less contained, like someone who hadn't yet decided what shape to make herself into. "There are people who want to know what happened," Marsh said, "on the Calderon operation." The name hit her somewhere behind the ribcage. "I'm sure there are," she said. "Will you talk to us?" She looked at the photograph, at the face that used to be hers, at the expression in it that she couldn't quite read anymore, like looking at someone she used to know before an event changed them in ways that don't fully translate. "I'll talk to you," she said, "but I need you to understand something first." Marsh waited. "Whatever I tell you," she said, "is going to change some things that certain people would rather stayed the same. And once I start talking, I'm not going to stop in the middle." Marsh exchanged a look with his partner that she wasn't supposed to catch, but she caught it anyway, because she'd been trained by people who specialized in catching exactly that kind of thing. "Understood," Marsh said. She straightened in the chair. Outside, down 2 floors and 30 meters, Ethan Cross was lying in room 114 with his arm in a brace and his eyes on the ceiling, waiting. And inside this consultation room, with a photograph of a dead life on the table in front of her, Maya Bennett opened her mouth and began to speak. She started with the part that was easiest to say out loud, which was also the part that mattered least. The Calderon operation had been a joint extraction in a mountainous region that didn't appear on any civilian map under that name. 3 teams, 2 objectives, 1 window that closed at 0400, or it closed permanently. She had been embedded with the secondary element as a combat medical specialist, not a title that appears in any personnel record from that period, but a function that 3 separate commanding officers had relied on in the preceding 18 months, because she was good at it, and she was small enough to fit in spaces that larger operators couldn't, and she could make decisions in the dark under fire without needing anyone to confirm them. Marsh wrote nothing down while she talked. His partner did, careful shorthand in a notebook with a green cover. She noted that and continued. The primary objective had been completed by 0200. Her element had been moving toward extraction when the second contact happened. Not unexpected, they'd been tracking the probability since the insertion, but the timing was wrong and the position was worse, and in the space of about 40 seconds, The situation rearranged itself into something that the planning documents had not anticipated. She stopped there. "The casualty," Marsh said. "Yes. Sergeant First Class Daniel Reeves." The name in someone else's mouth did something to the air in the room. She'd known he was going to say it, and it still landed like a change in altitude, that specific internal pressure adjustment, the kind that happens before your ears catch up. "Yes," she said. "Your official statement at the time indicated you performed emergency hemorrhage control and that Sergeant Reeves expired before extraction." "That's what my statement said." Marsh was very still. "Is that what happened?" She looked at the table for a moment. The photograph of her other self was still there, face up, the expression in it unreadable to her from this angle and this distance. "It's what happened," she said. "It's not all of what happened." She told him the rest. It took 11 minutes. She knew because she was watching the clock on the wall above Marsh's left shoulder, not to time herself, but because keeping track of elapsed intervals was a habit she couldn't turn off, something that had gotten wired in over years of working in environments where time was a resource with a hard limit. When she finished, the room was quiet for long enough that she could hear the ventilation system. Marsh looked at his partner. His partner looked at his notes. "The decision Reeves made," Marsh said carefully, "in the final 2 minutes of that engagement, was his," she said. "I didn't ask him to. I didn't know he was going to. But you were the reason I know why he did it." She stopped, started again. "I've known why he did it for 2 years. I just didn't know the outcome." Her voice was steady. The steadiness cost something, but she paid it. "I left before I could confirm. I was pulled out, and then I was debriefed, and the debrief gave me a version of events that I have reason to believe was incomplete." "Incomplete," Marsh repeated, "intentionally." The word sat there. Marsh put his pen down on the table. It was a small gesture, and it shifted the register of the conversation slightly, from formal inquiry to something more direct. "Ms." He stopped, tried again. "What name do you want me to use?" She thought about it. It was a strange question to have to think about. "Maya," she said. "Maya." He nodded. "The incomplete debrief. We've been looking at that from a different angle for the past 8 months. There are elements of the Calderon operation that don't reconcile with the official record, and what you've just described adds to a picture that we've been building." He paused. "I want to be straight with you. This conversation is going to have consequences. I know. It may not be comfortable ones. I know that too. There are people in administrative positions who have an interest in the current version of the record staying current." "Colonel Warren Bask," she said. Marsh's expression did something small and controlled. "That name is one we're aware of. He ran the debrief. He was the one who told me Reeves didn't make it out. He was the one who told me the manner of death." She looked at him directly. "He gave me a version of it that made me responsible. And you believed it. For 2 years I believed it." She paused. "I believed it because I was already—" She stopped. The sentence had an end she wasn't sure she was ready to say out loud yet. Not to Marsh, not in this room, with the green notebook and the fluorescent light that kept flickering slightly in her peripheral vision. "I was already in a bad place. I was grieving and I was running on empty, and someone I trusted gave me an explanation that fit the shape of the guilt I was already carrying, and I took it." Marsh was quiet for a moment. "We'll need a full deposition," he said. "Formal. On record." "Yes. That process will take time, and during it there may be attempts to interfere with your availability." She read that correctly. "You mean someone might try to remove me from the situation before I can testify?" "It's a possibility we're managing." "How are you managing it?" He glanced at his partner, who had stopped writing. "Captain Cross's presence here is not entirely coincidental," Marsh said carefully. She looked at him. "He's been working with us," Marsh said, "informally, for about 6 months." She sat back in her chair. The consultation room was small enough that there wasn't anywhere for the information to go except directly into her, and she felt it settle there with the weight of something she should have anticipated and hadn't, not entirely, not this specifically. "He knew I was here," she said. "He suspected. The equipment failure was real. That part was not manufactured. But when the ambulance routing came up on a screen in Kelman's Situation Room and the destination was Cedar Valley, he asked to be transported here rather than to the installation's medical facility." He chose to come here. Yes. She thought about the look on his face when the gurney came through the trauma bay doors, the way he'd tracked the room. She'd read it as the vigilance of a soldier in an unfamiliar environment, because that's what it looked like, because that's what he was. She hadn't read the layer underneath it, which was someone looking for a specific person. His arm, she said, was that the injury is genuine and it was serious. Marsh's voice was firm on this. Nobody manufactured that. He's been in significant pain since the incident and the outcome last night. What you identified and what Dr. Cole corrected, that was a real medical event. Cross's decision to ask for you was genuine, and it came from knowing what you'd done for him on Calderon. She processed this. He should have told me, she said, that he was working with you. He wasn't sure you'd stay in the room long enough for him to get to it. That was probably accurate. She didn't say so. What happens now? She asked. Marsh straightened the photograph and closed the folder. We'll reach out through proper channels to schedule the formal deposition. In the meantime, we need you to continue your normal routine as much as possible. Don't alter your schedule. Don't change your patterns. He paused. Dr. Cole's inquiry into your background is something we're aware of. It's unlikely to produce anything definitive given the nature of how your current documentation was assembled, but it may create institutional friction. It already has. Can you manage that? She looked at him with an expression that said she'd managed considerably more difficult things than an irritated trauma director, which was true, and which Marsh apparently received correctly because he nodded and didn't push it. One more thing, he said as they both rose. Captain Cross would like to speak with you, today, if possible. I know. He's been asking, I know. She picked up her badge from the table where she'd set it. I'll go. She went back to her floor first. Mr. Gaston needed his 2 p.m. medications and his 2 p.m. blood pressure check and a brief conversation about the PT exercises he'd been told to do and wasn't doing, which she navigated in 12 minutes because she'd gotten good at the specific art of redirecting him without making him feel managed. The post-surgical patients were stable. The chest infection patients' numbers were moving in the right direction slowly, with the kind of gradual improvement that only registers if you're tracking it carefully and is easy to miss if you're not. She tracked it carefully. At 2:45, she told Donna she had a patient consult on the second floor and took the stairs down. Room 114 was quieter in the afternoon. The overhead light was off and the room was running on the low natural light coming through the window, which at this hour was the same flat October gold she'd watched from the break room. Cross was awake, sitting up at approximately 45 degrees with his left arm immobilized across his torso and his right hand resting on the bed rail. He looked better than he had at 1 a.m., which wasn't saying much, but the color was improved and the tension around his eyes had reduced slightly, which meant the pain management was doing something useful. He looked at her when she came in and waited. She sat in the same chair as before. You knew, she said. I suspected. I didn't know you were here specifically until the ambulance routing came through. He watched her face. I wasn't playing you. I know the difference. Good. He shifted carefully. What did Marsh tell you? Enough. She looked at the window. He said you've been working with them for 6 months. Since I started understanding that the Calderon debrief wasn't what it was supposed to be, I started pulling threads, which is a bad habit I developed somewhere, and the threads led somewhere I wasn't expecting. He paused. They led to Basque. The name again. Twice in one afternoon, after 2 years of it living only in her own head. What did you find? She asked. Basque ran 4 debriefs in the 18 months around Calderon, Cross said. In 3 of them, the official record doesn't match the accounts of surviving personnel. The pattern is specific. Events get reordered, causality gets reattributed, and in each case the end result is that one person takes more culpability than the facts support, and the operational command escapes any accountability review. He stopped. You weren't the only one. She took that in. How many others left the service? She said. 2 that we know of. 1 is still in. 1... He stopped in a way that meant she should understand without him finishing, and she did. The October light moved slightly as a cloud shifted outside. Donovan, she said, you said last night you needed to tell me something about Donovan. Cross looked at her carefully. The care in it was not the softness of someone preparing to deliver something terrible. It was the care of someone who had thought hard about how to say a true thing in a way that the other person could actually receive. Donovan made it out, he said. The room did something strange. Not the room. The space inside her chest where she'd been carrying a specific weight for 2 years. What? She said. Her voice came out wrong, too small, too careful. He's alive, Maya. He survived the engagement. He's been… Cross stopped, started again. He's been in a situation that I can't fully describe yet, which is part of what Marsh's investigation is opening up. But he is alive. She looked at him. She was trying to find the lie in it, not because she thought Cross would lie to her, but because 2 years of carrying something teaches you to be suspicious of its absence. The same way a person who's been walking with a stone in their shoe for a long time will flinch when someone removes it, because the relief and the wrongness of the relief feel almost identical. Alive, she said. Yes. And Bask told you what Bask needed you to believe. His voice was level, but there was something underneath it that wasn't. He needed you gone. He needed you out of the service and out of the country, and not in any room where you might compare notes with anyone who'd been on that operation. Cross's jaw moved. Because you were the only one present for all 3 of the critical minutes that his version of events depends on. She was very still. He lied to get rid of me, she said. Yes. And Donovan was extracted under a different protocol. He's been not accessible. That's the most accurate thing I can say right now. But he knows you're out there, and he knows what Bask did, and he's been working with Marsh's team from his end for the past 4 months. She put her hands on her knees and looked at them. They were her hands, Maya Bennett's hands, Nightshade's hands, the hands that had been trained to do things, and then had spent 2 years trying to forget they knew how. They were slightly rough at the knuckles from the winter coming in, and from the hospital's obsessive hand-washing protocols, and there was a small scar along the base of the right thumb that she'd gotten in a place she couldn't name out loud, and they were completely still. You should have told me sooner, she said. I know. When you came in last night, I was on a gurney with a crushed arm in a hospital I'd never been to with a room full of people I didn't know, he said, and the flatness of it almost had a dry edge, almost like something that had to pass through considerable pain to reach anything close to humor. My timing options were limited. Marsh could have contacted me months ago. Marsh didn't know where you were months ago. I didn't know where you were. He stopped. You built a good disappearance. She had. She'd built it carefully and well, with help from people who asked no questions and owed her specific debts, and she'd maintained it with the discipline of someone who understood that the version of her life she'd left behind was not the kind of thing that stays buried without constant tending. She looked at him. What do you need me to do? Talk to Marsh. Tell them everything. The full deposition. He paused. And stop hiding. I'm not… You're hiding, he said, gently but without qualification. Not from the hospital. Not from Cole or anyone in this building. You're hiding from the person you were and what that person did and the fact that what she did was right and not wrong, even though someone spent 2 years telling you a story in which it was wrong. He looked at her steadily. You saved my arm, last night, with the whole room watching and Cole standing there like a wall. You didn't hide then. That was different. How? She opened her mouth, closed it. How was it different? He said. She didn't answer because the answer, if she let herself follow it to the end, was that it wasn't different, or wasn't different in the ways that mattered, and that was a conclusion that had more implications than she was ready to sit with in a hospital room at 3 o'clock on a Tuesday afternoon. I'll talk to Marsh, she said. Good. And I'm going to need you to stop calling me Nightshade in public areas. Something crossed his face. Not quite a smile. The muscles were probably too tired for a full smile, but the intention of one. Agreed. She stood. She was halfway to the door when the monitor beside his bed made a sound. Not an alarm. Not yet. But a change in the baseline pattern, a rhythm shift, the kind that a trained eye catches 2 seconds before it develops into something the machine flags. Maya turned around before the sound had finished registering, which was a reflex too fast to be thought and too specific to be random, and she was back at the bedside before Cross had fully processed what she'd done. She looked at the readout. His heart rate had been sitting at 78. It was at 91 and climbing, and the waveform, she looked at the waveform, at the shape of it, and something in her went very quiet the way it did in the field when you needed all of your attention pointed at one problem at once. Cross. Her voice was level. Any chest pressure? He frowned. Some. I thought it was the position. When did it start? 20 minutes, maybe? I didn't. Okay. She reached for the call button and then made a faster calculation and went directly to the door. Nurse. She didn't raise her voice, but she made it carry. Petra, the OR nurse from last night, was at the station. I need a 12 lead in 114. Now, please, and get the attending on call. Petra read her face and moved. Maya went back to Cross. Don't move. Stay exactly where you are. What is it? Tell me about the sensation. Sharp or pressure? Pressure. Left side. Down the arm? He stopped. Registered the irony of the question given the state of his left arm. Right arm. Some. She was watching the monitor. 97 now. The waveform was doing something she didn't like. Post-surgical vascular patients had specific risk profiles. She knew them the way she knew other things. Not from textbooks, though she'd read those too, but from the particular education of having been present when things went wrong in places where the only response available was whatever she could do with what she had. The repair from last night was solid. Cole's work had been technically correct. She'd had the readout described to her by Voss this morning. But the physiology around a repaired vascular injury didn't always cooperate with the technical success of the repair, and in the first 24 hours, the attending on call arrived, a woman named Dr. Safi, who moved fast and asked good questions and had the useful quality of not needing to establish authority before she started working. Petra was behind her with the portable 12 lead. What are you seeing? Safi said to Maya, which was the right question, the one that treated the information source as the information source rather than as the problem to be worked around. Rate elevated and climbing, waveform changes starting about 2 minutes ago, patient reporting left-sided chest pressure and right arm radiation for approximately 20 minutes prior. She stepped back to give Safi access to the patient. He's 18 hours post-repair of a left upper extremity vascular injury. I don't know if this is related to the repair or a separate event. Separate's more likely, Safi said, already moving. But either way, she was attaching leads. Have cardiology paged? Doing it, Petra said. Get an echo cart. Yes. Cross was watching all of this with the specific expression of a man who has been in bad situations before and knows the difference between controlled urgency and actual panic, and what was in the room was the former, which he was reading correctly, but which was not the same thing as the situation not being serious. This is something, he said, not a question. We're figuring out what, Safi said. Do you have a cardiac history? No. Anyone in your family? Father, heart attack at 61. Safi noted it without looking up. The leads were on. The 12-lead printout started coming through, and Maya was positioned at an angle where she could see the trace, which was not her place and not her information to act on, but she could see it. She saw the ST elevation. It was small, 1 millimeter, maybe 1.5 millimeters, but it was there, consistent across the lateral leads, and in a man who'd been through significant physiological stress in the past 18 hours, it meant something. Dr. Safi, she said. Safi had already seen it. I know. She reached for the phone on the wall. I'm calling a STEMI alert. The room changed. Maya stepped back to the wall, out of the functional zone, because this was no longer a space where she had a role to play, and she knew it, and knowing it, and staying in the way were two different things. She pressed her back against the wall and watched the room reorganize around the specific urgency of a cardiac event in a post-surgical patient. And she watched Cross in the middle of it, his face, the control in it, the discipline, the way he was managing his breathing deliberately, because he'd been trained to manage his breathing under pressure, and the training didn't stop just because the pressure was medical rather than tactical. He looked at her across the room. She held his gaze. She didn't look away, and she didn't leave. And whatever the look said between them, it said it without words, the way some communications work best. And she stayed against that wall while the cardiology team arrived in the room filled with purposeful noise and the specific machinery of an institution responding to something that had a narrow window. She was still there when Cole walked through the door. He'd been in the building. She didn't know why. He shouldn't have been on shift. But he was here, and he took in the room in one sweep, and his eyes landed on the 12-lead readout and then on Maya against the wall. and something moved across his face that she couldn't fully read from this distance. "What happened?" he said to Safi. "STEMI alert. Possible cardiac event, post-surgical. We're moving to cath lab." Safi's voice was efficient and clear. Bennett identified the initial rhythm change. Cole looked at Maya, not with the sharp administrative attention he'd been training on her for the past 18 hours, with something else, more complicated, less legible. "You were in the room," he said. "I was visiting," she said. "You identified it." "I saw the monitor change." He looked at her for another moment, and she couldn't tell what he was deciding, but he was deciding something. She could see the process of it happening in real time in the set of his face and the particular quality of his stillness. Then Safi said, "We're moving," and the room burst into organized motion. The gurney being unlocked from its position, the leads being managed, Cross being told to stay still and staying still. And Cole stepped aside to let them through, and Maya pressed against the wall and let them pass. Cross went past her. His eyes found her for 1 second in the movement, and he said nothing because there was nothing to say that could fit in a second, and then he was through the door and the room was suddenly half empty, and the particular urgent hum of the STEMI response was moving down the corridor toward the elevator. Maya stood against the wall. Cole was still in the room. Just the two of them now, and the equipment the team hadn't taken, and the flat October light through the window. She expected him to say something pointed, something administrative, something that would land in this moment with the weight of all the preceding 18 hours and serve notice of whatever he'd been building in HR since the night before. Instead, he said, "How did you know?" His voice was flat and real and did not have the cultivated authority in it that he usually wore like a coat. It was just a question. She looked at him. "The waveform," she said. "The pattern changed." "You were watching his monitor?" "Yes." "While you were visiting?" "Yes." He was quiet. "If you hadn't been here," he said. She didn't answer that. The conditional wasn't useful. The conditional was the kind of thing you thought about later, in the dark, when there was nothing else to do with your hands. Cole looked at the empty bed. At the readout still showing on the monitor above it, the trace from before the team had removed the leads. The elevated ST, the climbing rate, the record of something that had been happening for 20 minutes before anyone caught it. He looked at it for a long time. Then he turned and walked out of the room without saying anything else. Maya stood alone in room 114, looking at the same readout, in the same October light, and somewhere 2 floors up and half a building away, Marcia's partner was still writing in a green notebook. And somewhere in the hospital's cath lab, the team was working on a soldier who knew where she'd been for 2 years and had come a long way to find her, and on the 3rd floor there was an HR file with her name on it that contained a construction someone was going to start taking apart. She stood there until she trusted her legs. Then she walked out and took the stairs back up to her floor and picked up the next task that needed doing, because that was what you did. That was the only thing you could do. When the world had tilted past the point where standing still made any sense. Behind her, on the monitor in room 114, the trace continued scrolling across an empty screen. The record of a heart in trouble, caught by someone who had no business being in that room, and who had been there anyway. The cath lab took 2 hours and 40 minutes. Maya knew because she was on the floor the entire time, working her patient load with the specific focused efficiency of someone who has redirected everything that cannot be used into the only channel available. Mr. Gaston got his 3 p.m. vitals, his medication review, and a conversation about the PT exercises that this time was less gentle and more direct because she didn't have the bandwidth for gentle, and he responded better to direct anyway, which she'd known for a week and had been too careful to use. The post-surgical patients got thorough checks. The chest infection patient's oxygen numbers had improved by 2 points, which was small and was real, and she noted it with the same precision she brought to everything else. At 5:42 p.m., Petra came to the floor and told her Cross was out of the cath lab and stable. Maya nodded and went back to her chart. Petra stood there for a moment longer. "They placed a stent," she said. "Single vessel. He's in recovery." "Good," Maya said. Safi said if the rhythm change had gone another hour without being caught. Petra stopped. "Thank you, Petra." Petra left. Maya finished the chart entry she was on, started the next one, and worked through until the end of her shift at 7 without stopping. When the handoff was done and the night nurse had everything she needed, and Mr. Gaston had been told firmly that his next call button press had better involve something requiring actual clinical attention, Maya collected her bag and her jacket and went down the stairs. She went to recovery. Cross was awake, which she'd expected. He was the kind of person who came back from sedation fighting. She could have told any anesthesiologist that before the procedure and saved them some trouble. He looked worse than he had that afternoon, which was the honest aftermath of what his body had been through in 24 hours. The crush injury, the vascular repair, the cardiac event, the intervention. He looked like a man who had been used hard and was running on something below the level of reserve. He looked at her when she came in and said, "You saved my life again. Dr. Safi and the cath team saved your life. You caught it. I was in the room. Maya." His voice had very little left in it, and he used what he had carefully. "Stop deflecting." She sat in the chair. It was becoming a specific chair in a specific room, which was a kind of familiarity she hadn't intended to build, but had apparently built anyway. "How do you feel?" she said. "Like someone went into my chest with a wire." He paused. "Which they did." "Pain level." "Manageable." He looked at her. "Stop doing the clinical thing. It's what I have right now." "I know." Something in his face softened, just slightly, in a way that had nothing to do with weakness and everything to do with understanding that some people's kindness wears a clinical coat because that's the safest place to keep it. "Sit with me for a while." She sat. The recovery room had the specific suspended quality of a space where time moves differently, slower, more granular, each minute more present than the ones in the ordinary world outside. The light was low. The monitors ran their quiet commentary. Outside the window, Doral had gone to its nighttime configuration, the particular orange-gray of a mid-sized city after dark. "Marsh told me you heard about Donovan," Cross said after a while. "Yes. I should have told you last night. You told me when you could. I kept thinking about whether it was better for you to know right away or—" He stopped. "I'm not actually good at that kind of calculation. Tactical decisions? I'm fine. How to tell someone that the thing they've been grieving was a lie? That's a different skill set." "It's not a skill set," she said. "It's just a hard thing." "Yeah." They sat with that. "Donovan," she said, and the name in her own mouth felt strange, used and disused at the same time, like a word in a language she'd stopped speaking. "Where is he?" "Stateside. He's been stateside for 5 months. Marsh's team has him in a location I don't have the address for, partly for security and partly because the situation around him is still being managed." Cross looked at the ceiling. "He wants to see you." The information went into her somewhere deep and didn't immediately come back up in a form she could name. She sat with it. "When this is over," Cross said, "when Marsh has what he needs, and Basque is, when it's done." "Basque is the kind of person who has resources," she said. "He's been sitting in that position for 6 years. He's got relationships in at least 3 oversight committees that I know of from before I left, and those don't disappear because an investigation opens." "No," Cross agreed. "They don't disappear, but they get complicated." "How complicated?" "Marsh's team isn't working alone. There are parallel processes happening that I don't have full visibility into, and that's intentional. They're running it compartmentalized, so no single point of compromise can shut the whole thing down." He shifted against the pillow, and the shift cost him, and he didn't hide it, but he also didn't dwell on it. "What I know is that your deposition, combined with 2 other accounts they've been developing, gives them enough to move to a formal review board. From there it becomes institutional," she said, "which is slow, which is how it's going to stick," he said. "Fast falls apart, slow sticks." She thought about that. It was probably true. It was also the kind of truth that required you to sustain something over a long period, and sustaining things had been harder in the past 2 years than it had been before, for reasons she didn't need to articulate to anyone in this room. "Cole came to see you," Cross said. She looked at him. "When?" "About an hour before you got here. He came in, looked at me for a while, asked how I was doing in the tone of someone who doesn't entirely mean the question, and then said something I wasn't expecting." She waited. "He said he was withdrawing the HR inquiry." The recovery room was quiet. "He said that," she said. "Verbatim. The inquiry into Ms. Bennett's background has been suspended pending review of the clinical incident documentation, which is administrative language for he's dropping it. She sat back. Why? I think, Cross stopped. I think he's a complicated person who did a bad thing, which is that he almost amputated my arm because he didn't want to hear a floor nurse's read. And I think he knows it. And I think watching you catch something that would have killed me this afternoon gave him a specific kind of uncomfortable information that he doesn't know how to put back in the box. That's not accountability, she said. That's just discomfort. Sometimes they look the same from the outside. They're not the same. No, he agreed. They're not. She drove home at 9:15 through streets that had the specific emptiness of a weeknight in late October, the kind of quiet that feels like the city is waiting for something. Her apartment was the third floor of a building that had 12 units and a property manager who asked no questions about the lease deposit, and a laundry room that worked on Tuesdays and Thursdays. She'd chosen it for proximity to transit and the fact that it had 2 exit points and a stairwell that reached the roof. Old habits. She made tea she didn't drink and sat at the kitchen table and thought about Donovan. Marcus Donovan had been 5 years older than her and had the specific quality of competence that doesn't announce itself, the kind you only recognize in motion, in the moment when a situation goes sideways and the people around you slow down, and he sped up, not frantically but with the clean acceleration of someone who's made peace with exactly this kind of thing. He was the one who'd told her, early in her first year, that the difference between a good medic and an excellent one was not the procedures they knew, but the pace at which they could make decisions when the information was incomplete. She'd thought about that sentence approximately 10,000 times in the past 2 years. She'd thought about it in the specific context of a night when the information had been critically incomplete, and a man named Warren Bask had filled the gap with something that was not information, but had felt like it. She looked at her hands on the table. She thought, he's alive. And the thing was that she had believed he was dead with such completeness, had constructed her understanding of herself around that loss so thoroughly, that even now, with Cross's voice in her memory saying he's alive, clear, certain, the voice of a man who does not make imprecise claims, she couldn't fully feel it yet. It sat at a distance. It would need time and probably a specific moment and possibly seeing him in person before the information and the reality of it became the same thing. She needed to give her deposition. She needed to do it carefully and completely, and she needed to do it before Bask had time to understand the specific shape of what Marsh was building, because if Bask understood the shape too early, he would move to protect himself in ways that would cost other people. And she understood this about him because she'd watched him operate for long enough to know that his first instinct was always to make the problem someone else's. She went to bed at 11 and slept, which she hadn't been certain she would be able to do. The deposition happened the following morning at 7 a.m. in a federal building 20 minutes from Cedar Valley, in a room that had the carefully neutral decor of a space designed to be nobody's home territory. Marsh was there, and his partner with the green notebook, and a woman Maya hadn't seen before, who was introduced as legal counsel for the investigating body, and who had the specific alert stillness of someone who has read a lot of documents about this situation and is now looking at a primary source. Maya talked for 3 hours. She was not by nature a talker. She had built herself around the practice of saying the necessary thing and stopping, which in most circumstances was efficient, and in this circumstance required some deliberate adjustment. Marsh and his team needed the full account, not the edited version. The timeline, the specific decisions, the exact sequence of the final minutes of the Calderon engagement, the debriefing room and what Bask had said, and in what order, and the particular phrasing he'd used when he'd told her how Donovan had died, which she remembered with the precision of something that had been reviewed approximately 10,000 times. When she was done, the legal counsel looked at her notes for a long moment without speaking. This corroborates the cross-reference accounts from Captain Cross and the secondary source from our other witness, she said finally. With your formal deposition on record, the review board has sufficient grounds to escalate. Escalate to what? Maya said. Formal investigation of Colonel Bask's conduct across the relevant operations, potential charges under the Uniform Code for officers in the chain, and the complication. The legal counsel paused. Bask has, as of this morning, requested an urgent meeting with his oversight contacts. We believe he's become aware that the investigation has expanded. Marsh looked at Maya. We need you to be careful today. What does careful mean specifically? It means stay in public places, stay at your normal routine, and call this number if anything changes. He slid a card across the table. She took it. He'd have to be extremely reckless, she said, to move directly against a civilian. He's facing career termination and potential prosecution. People make bad calculations under that kind of pressure. Marsh's voice was even. We're managing it, but I want you to know the landscape. She looked at the card. Then she put it in her jacket pocket and stood up. I have a shift at noon, she said. Go to your shift, he said. Normal routine. Cedar Valley at noon had the specific energy of a Thursday. The week had found its rhythm. The daytime staff were into the particular focused middle section of a shift where the early chaos had settled and the end-of-day pickup hadn't started yet. Maya came in through the side entrance, collected her assignment, and was on the floor by 12:15. Donna was at the station. She watched Maya check in and come around the counter and start pulling the afternoon assignment without comment, which was unusual. Donna was not a quiet person when there was something on her mind. Cole had a meeting this morning, Donna said, after about 3 minutes. Maya kept pulling the assignment. Okay. With hospital administration, the CNO and 2 board members. Donna paused. Word is it wasn't friendly. Maya looked up. Petra heard from the OR scheduler who heard from the CNO's assistant, Donna said, in the specific tone of hospital communication that acknowledges its own chain of transmission while maintaining confidence in the endpoint. They were reviewing the decision-making documentation from the cross-vascular repair, specifically the initial assessment and the call to proceed with amputation before full imaging. Cole changed the plan when the imaging came in, Maya said. Yes, but the question on the table is whether the imaging should have been part of the initial assessment before the plan was set. Whether proceeding to surgical amputation without a complete vascular imaging workup was... Donna stopped. The phrase that came back was inconsistent with current standard of care. The ward had the normal sounds of a midday Thursday around them. A cart going past. A monitor running its steady commentary from room 3. Somewhere down the hall, Mr. Gaston calling for something. How did Cole handle it, Maya said. Badly, from what Petra heard. Got loud, which, with this administration, is not helpful. Not helpful, Donna agreed. Maya picked up her assignment sheet. I should get to my patients. Maya, Donna said it quietly. Maya stopped. I've been a nurse for 22 years. I've worked with people who are good at this job and people who are less good, and I can usually tell the difference inside a week. She paused. I knew what you were inside a week. I didn't know what I was looking at exactly, but I knew the quality of it. Maya stood there. Whatever is in your file or not in your file, Donna said, the work is what it is. People are alive because you were in the building. It was one of the more direct things anyone had said to her in recent memory, and it landed somewhere she hadn't been braced for it to land. Thank you, she said. She meant it fully, which was not a state she arrived at often. She went to her patients. At 3 p.m., Voss found her again. He developed a habit of finding her at specific intervals, which she'd started to recognize as the behavior of someone who was processing something and needed to do it in proximity to the source. She didn't mind it exactly. He was not a complicated person to read, and he was working something real, and that was worth more than the alternative. Cole's been suspended, he said. He said it like he wasn't sure how it was going to land. She looked at him. Pending the administrative review? Pending investigation. The board wants an independent audit of his decision-making on the Cross case and at least 3 prior cases that have been flagged. He paused. Dr. Rice is interim trauma director. She knew Rice by reputation, a woman who'd trained in Pittsburgh, published work on vascular trauma protocols, and had the specific kind of institutional knowledge that comes from being in a place long enough to understand what it actually is, rather than what it aspires to be. Rice is good, Maya said. Yeah. Voss was quiet for a moment. Cole's going to say it was about you, that the administrative review started because of what happened with your credentials. He can say that. The timeline doesn't support it. The prior case flags predate your arrival. He paused. I know that. I looked. She studied him. Why did you look? Because I needed to know if this was about the right things. He said it simply, without self-consciousness. And it is. The prior cases have problems that have nothing to do with you, problems that have been sitting in the documentation for a while without anyone picking them up. She thought about the specific machinery of institutions, the way bad decisions accumulate in records and sit there waiting for someone to look, the way the looking requires both the will and the moment is often something unpredictable and human that creates the opening. Good, she said. That matters. Yeah. He looked at his shoes briefly, then back at her. I told Safi it was you who caught the cardiac rhythm change. I put it in my case notes. Voss, it should be documented. It's a clinical fact and it should be in the record. He looked at her steadily. You were there. You caught it. That goes in the chart. She held his gaze for a moment. Thank you, she said. He nodded and walked away. Cross was moved out of recovery and back to a room at 4 that afternoon. Not room 114, which had been reassigned, a different room on the cardiac step-down unit, which had its own particular atmosphere, quieter and more deliberately paced than the general surgical floor. Maya finished her shift at 7 and went to see him. He was sitting up at a better angle than the day before, the left arm still immobilized, but the color genuinely improved and the residual sedation entirely gone from his eyes. He looked like a man who had been through a specific ordeal and had decided that the ordeal was over and he was now on the other side of it. Cole's suspended, she said, sitting down. I heard. He watched her. How are you doing with that? It's complicated. Because you think it should have come with more of an explanation from him. Because I think... She stopped, organized the thought. Because institutional accountability and personal accountability are two different things, and sometimes only one of them happens, and you have to decide whether that's enough. Is it enough? Not entirely, but it's real. She looked at the window. Real is what you work with. Marsh called me this afternoon, Cross said. They moved on Basque. She turned back to him. Formal notification of investigation, which is the step before charges. He's been relieved of his command position pending the review. Cross's voice was even. His oversight contacts are being separately reviewed for their handling of the prior complaints about his debriefing practices. 3 of them are in advisory positions that require security clearances, and those clearances are now under scrutiny. She sat with that. Warren Basque had a certain kind of face. She could see it clearly in her memory, the face of a man who had learned that authority is most effectively deployed quietly, who had spent a career constructing the appearance of impartiality while very deliberately steering outcomes. She thought about him receiving formal notification. She thought about the specific quality of the moment when someone who has been protected by institutional position for a long time finds the protection suddenly conditional. He's going to fight it, she said. Of course he is. He has people. Yes, and those people now have their own problems, which changes the calculation. Cross paused. Marsh says the review process is 12 to 18 months. Maybe longer. It's not going to be fast. It's going to stick, she said, using his word from the night before. Something in his face shifted. Recognition, maybe. Yes. She looked at her hands in her lap. I want to ask you something, and I want you to answer it straight. When have I not answered you straight? Cross. Ask. Donovan, she said. The thing Basque told me. About how it happened. She stopped. The words had a specific texture that made them hard to push through. I need to know the actual account, not the fact that he's alive. The account of those 2 minutes. Cross was quiet for a moment. He'll want to tell you himself, he said. I know. But I need to hear a version now. She stopped again. There was something underneath the clinical steadiness that she'd been managing for 48 hours. Something that had been waiting for a room where it could exist, and this appeared to be the room. I need to stop carrying the version Basque gave me, she said. I need something true to put in its place before I can. I can't wait until the investigation is done. I can't carry his version for another 12 to 18 months. Cross looked at her for a long moment. Donovan was in a covered position 10 meters from your location, he said. He saw the second element moving to intercept before you did. He made a decision. Independent, his call entirely, to create a diversion that would redirect the contact away from your extraction line. He paused. It worked. It worked completely. He drew the contact you extracted successfully, and he... Another pause. He was injured, significantly, but the element that extracted him after you cleared found him alive. Critically injured, but alive. She sat very still. The version Bask gave you, Cross said. The version where you failed to maintain his position, where your decision-making in the final minutes caused his death. It wasn't true, she said. She knew this. She'd heard it from Marsh. But hearing it now in the specific form of the actual account was a different thing. It was constructed, Cross said. Bask needed you out, and he needed you to have a reason not to come back. He used what he knew about what you were already feeling, and he built something that would hold. It held for 2 years, she said. Yeah. Cross's voice had something in it that wasn't quite anger and wasn't quite grief. It held. She breathed. The cardiac step-down unit went on around them in its quiet way. Monitors ran. Somewhere down the hall, a television was on at low volume. His decision protected you, Cross said. He knew what he was doing and he made the choice. That's not your failure. That's his service. She looked at the window. The city outside was doing its nighttime thing again. The orange-gray, the distant movement of traffic, a world that had been going on continuously through all of it, 2 years of it. The city had not noticed. The world had continued. She had been inside it, managing, maintaining Maya Bennett, going to shifts and checking vitals, and apologizing reflexively to people who hadn't said thank you. She was tired of carrying things alone. I know, she said, and for the first time in 2 years the sentence had no qualification in it. Not, I think I know or I'm trying to know, just the bare fact. Cross nodded. He didn't say anything else because there wasn't anything else to say, and he understood that. They sat in the quiet until visiting hours ended, and then Maya stood up and gathered her things. She was at the door when his voice reached her. Marsh called about one more thing. She stopped. The deposition you gave this morning, one of the corroborating witnesses. He paused. Donovan has given his account. It's been formally recorded as part of the investigation. She turned. They recorded his account, she said, this morning, roughly at the same time you were giving yours. Cross looked at her steadily. You were both in rooms 200 miles apart describing the same 2 minutes from different positions, and the accounts match. She stood in the doorway. Marsh says the legal counsel cried, Cross said, which apparently almost never happens. The information settled into her and kept settling, like something finding the level it had been looking for. She was about to say something, she didn't know what, something that didn't have words yet, when her phone buzzed in her jacket pocket. She pulled it out. The number was not one she recognized, which in ordinary life would have been nothing, a spam call, an insurance follow-up, something. But the area code was specific and it matched a region she knew and had not thought about in the context of phone calls, because phone calls from there were not a thing that happened in the life she'd been living. Her thumb hovered over the screen. Cross couldn't see the phone from where he was, but he could see her face. What is it? She looked at the number. I don't know yet, she said. The phone buzzed a second time. She answered it on the third buzz. She didn't speak first. That was another old habit. You answer, you listen, you identify before you commit to anything. The hallway of a cardiac step-down unit at 7:45 in the evening was not the environment she would have chosen for this, but the environment didn't ask her preference. The voice that came through was rougher than she remembered, slower. It had the specific quality of someone who has relearned how to do something that used to be automatic. The cadence slightly deliberate, like a man being careful with each word because he'd had a period where words weren't available and he hadn't fully stopped being careful about them. Maya. She put one hand flat against the wall beside the door. Marcus, she said. Across the room, Cross went very still. There was a pause on the line. Not uncomfortable, not the pause of someone who doesn't know what to say, but the pause of two people who have been carrying the same weight from different sides of it and have arrived simultaneously at the moment of setting it down and aren't entirely sure what their hands are supposed to do next. Marsh told me you gave your deposition today, Donovan said. This morning. Her voice was steady. She made it steady deliberately, and then it became steady on its own, the way things do when you've held them long enough. He told me you gave yours. Yeah. Same morning. Yeah. A breath. Felt right, doing it at the same time, even if we were 200 miles apart. 200 miles apart, he agreed. She looked at the wall in front of her. Pale institutional green. A scuff mark at approximately shoulder height where a gurney had caught it at some point. The specific material reality of a place that had nothing to do with any of this, and somehow was where all of it had arrived. "Are you okay?" she asked. It was a smaller question than anything else she could have asked, and it was the right one. "Getting there." He paused. "You?" "Getting there," she said. Another pause. This one had something warmer in it, something that wasn't resolution exactly. Resolution was a word for documents and formal outcomes, but was in the same neighborhood. "When it's over," he said. "The investigation. I want to—" He stopped. Started differently. "I want to have a conversation that isn't in a deposition room." "Yes," she said. "Me too." "Okay." She could hear something in his voice settle. "Okay." Then that's what happens next. They stayed on the line for another few seconds without speaking, and then said goodbye in the simple way of people who have confirmed the only thing that needed confirming, and she ended the call and stood against the wall and breathed twice. Then she went back into the room. Cross was looking at her with an expression that asked the question without using words. "He sounds like himself," she said. "Slower, but himself." Cross exhaled. It was a long exhale, the kind that comes at the end of something sustained. "Good," he said. "That's good." She sat back in the chair. Outside the window, the city was exactly where it had been 20 minutes ago, doing what cities do. She looked at it for a while. "I'm going to be okay," she said. She wasn't saying it to Cross specifically. She was saying it in the way you say a true thing out loud when you're not yet 100% certain. It's true, but you're certain enough that saying it out loud is the appropriate next step. "I know," Cross said. She stayed another 10 minutes. Then she went home. The weeks that followed had the quality of aftermath. Not the dramatic kind, not the kind that announces itself with obvious signposts, but the quiet grinding work of things restructuring themselves after a significant event. It looked like ordinary life from the outside. Inside, it was entirely different. Cole's administrative review expanded within the first 2 weeks to include 6 prior cases. The independent audit that the hospital board had commissioned came back with findings that were, in the language of the formal document, inconsistent with established standards of care in 3 of the reviewed instances, which in plain language meant that people had been harmed by decisions that shouldn't have been made the way they were made. And the institution had a record of it that had been sitting unexamined. Cole had his hospital privileges suspended pending the outcome. He retained a lawyer and issued a statement through the lawyer that characterized the review as procedurally flawed, which was the kind of statement that sounds like defense and reads like confirmation. Rice, the interim trauma director, had a different way of moving through the ward. She asked questions where Cole had issued directives. She reviewed documentation before making calls rather than after. She had a brief conversation with Maya in the second week, not in an office, in the hallway, standing, both of them with things to get back to, in which she said, "I've read the Cross case notes. Voss's documentation is thorough. I want you to know that if you have clinical observations during a patient encounter, I want to hear them." Maya looked at her. "Through appropriate channels," Rice added, with the small, dry awareness of someone who understood that appropriate channels had not exactly been a feature of how this had gone. "Understood," Maya said. "Good." Rice moved on. That was all. It was enough. Mr. Gaston was discharged in the 3rd week. He hugged her on the way out. She hadn't anticipated this, and her response was approximately half a second behind the gesture, which he noticed and found funny. "You're not a hugger," he said. "I'm working on it," she said. He laughed and went home, walking better than he had any right to walk after the injury he'd come in with, driven by his daughter, who had the warm, exhausted look of someone who had been worried for a long time and was working through the transition to relief. Maya watched them go from the nurse's station and felt something specific and uncomplicated, which was that this was why the work existed. The whole complicated institutional apparatus and the documentation and the handoffs and the hierarchy and all of it, it existed so that this man could walk out to his daughter's car and go home. She held on to that. 7 weeks after Ethan Cross had come through the trauma bay doors on a gurney with a crushed arm and a word that didn't belong in a civilian hospital, Warren Bask was formally charged. Maya read about it in the notification Marsh sent. Not a dramatic revelation, just a document, formal language, The specific dry vocabulary of institutional accountability, doing its work. Conduct unbecoming. Falsification of operational records. Abuse of authority in the administration of post-operational debriefs. 3 counts relating to the Calderon operation specifically, and 2 from prior incidents that the expanding investigation had surfaced. He would face a military tribunal. The process would take longer than anyone wanted. He had lawyers and he had resources and he would use them, and the outcome was not predetermined. But the charge was real, and the record was real, and the people he had silenced had spoken, and those words were now in official documents in multiple locations that could not be recalled or reordered or shaped into something else by a man sitting across a table from someone who was already grieving and exhausted and willing to believe the story she was given because it fit the guilt she already carried. Maya sat with the notification for a while. She thought about the 2 years, not with the specific acute pain she'd been carrying them, that had changed in texture, not gone, but changed, the way scar tissue is different from a wound. She thought about the things she'd done in those 2 years that had been worth doing. The patients she'd helped in the rural clinic she'd worked at before Cedar Valley. The specific accumulation of small acts of competence in the service of people who needed them. She thought about Mr. Gaston. She thought about the moment she'd put her hands on Cross's arm in the trauma bay and read what was there. She thought, I was still myself even when I thought I wasn't. That was something. That was in fact a lot. She closed the notification and went to her next shift. Cross was discharged on a Tuesday. His arm would need months of rehabilitation, the kind of slow, deliberate work of rebuilding strength and range in a limb that had been through significant trauma twice in 48 hours. The cardiac situation required its own management, medications, follow-ups, the specific long conversation with a cardiologist about what his life looked like going forward and what adjustments were non-negotiable. He was not going to return to operational status in any form she recognized, and she thought he probably knew this and was somewhere in the process of deciding what that meant for the person he was. She came to the room while he was waiting for the discharge paperwork, which at Cedar Valley took approximately as long as you'd expect. He looked like himself, the post-hospital version of himself, which was thinner and moved more carefully, but the eyes were the same, the specific quality of attention in them unchanged. They're sending me to the Kelman Medical Facility for the follow-up care, he said. It's close enough. That's good. Yeah. He looked at her. You're staying. I'm staying. She said it without hesitation, which surprised her slightly, and then didn't because she'd been deciding it gradually for weeks without announcing it to herself. Cedar Valley was not a perfect institution. No institution was. But Rice was building something real in the trauma department, and Voss was going to become a good doctor if someone was around to push back on him at the right moments, and the work was the work regardless of the building it happened in. I told Marsh you were staying, Cross said. I figured. He said they may need you for follow-up interviews as the tribunal process develops. I know. I told him yes. Cross nodded. He was quiet for a moment in the way of someone who has something to say that doesn't fit in the framework of information exchange. That night, he said, in the trauma bay, when they were about to take my arm. He stopped. I knew you'd see it. I knew if I could just get you to look at it, you'd see what was there. You were betting your arm on that certainty, she said. I was betting my arm on knowing you. He said it simply, which is a different thing. She sat with that. I didn't know if I was still that person, she said. When I put my hands on your arm, I genuinely didn't know if what I was going to find was still there. Was it? She looked at her hands, which were resting in her lap in the particular way they rested when they weren't doing anything, which was the way hands look when they're just hands, and not anything more or less. Yes, she said. He nodded, like she'd confirmed something he'd already known and had been waiting to hear her confirm. The discharge paperwork arrived. A nurse went through it with him. Not Maya, someone from the cardiac step-down unit who'd been assigned to the process. Maya sat against the wall and watched Cross navigate the instructions with the patient attention of a man who has recently had a cardiac event and has recalibrated what he's willing to be impatient about. When it was done and the nurse had left, he stood, moved carefully, his left arm in its brace, his right hand steady. He looked at her. Ready? She said. No, he said. But that's never been a requirement. She almost smiled. It was close enough to one that it counted. She walked with him to the elevator, and in the lobby his transportation was waiting. A car from Kelman, a driver in civilian clothes who had the specific bearing of someone who is not just a driver. Cross paused at the door. He turned to her. He raised his right hand. The left was immobilized, would be for weeks yet, but the right came up clean and deliberate, the full formal salute, the same one he'd given in the trauma bay 6 weeks ago, except that this time there were no monitors screaming and no doctors frozen in place and no supply tray hitting the floor. Just the two of them in a hospital lobby on a Tuesday afternoon. She looked at him. The salute. She didn't return it in the military form. She wasn't in the military, hadn't been for 2 years, and the gesture she made was something else, something smaller and more personal, a nod that carried the weight of everything it would have taken a long time to say and didn't need to be said. He got in the car. She stood in the lobby until it pulled out of the hospital drive and went left onto the main road and disappeared into the ordinary Tuesday traffic of Doral. Then she went back upstairs. She called Donovan on a Thursday evening 6 weeks after the night in the cardiac unit, not because the investigation was over. It wasn't. It was doing what Marsh had said it would do, which was moving slowly and sticking, but because the conversation that wasn't a deposition didn't need the investigation to be over. That had been a condition she'd set without examining it, and when she examined it, it fell apart. He answered on the second ring. They talked for 2 hours. Not about the operation, not about Basque, not about the deposition or the tribunal or any of the formal process that was grinding forward in rooms full of lawyers and documents. They talked about the 2 years, his version and hers, the parallel lives they'd been living in different places, the specific texture of trying to maintain yourself when the version of events you'd been given about a formative moment was false, and you didn't know it was false. He'd had a different experience than she had, where she had made herself smaller. Maya Bennett, floor nurse, apologizing reflexively to people who didn't notice. He had gone the other direction, becoming more visible in certain ways while being invisible in others, which was a different strategy for the same underlying problem. We both kept working, she said. Yeah. Whatever else happened, we kept working. It's what we know how to do, he said. She thought about that. It was true, and it was also more than that. It wasn't just habit or training. It was something more fundamental. The thing underneath the skills and the designations and the identities she'd worn and set aside. She cared about the work. She'd cared about it in the military context, and she cared about it in the hospital context, and the caring didn't require a uniform or a call sign or anyone's recognition to be real. That was the thing Basque hadn't been able to take. He'd taken 2 years and a version of events and her sense of what she'd done and left behind. He hadn't taken the underlying thing. I want to meet, Donovan said. Yes. After the tribunal, when I can travel without the... He paused. When the situation allows. Yes, she said. After. It was enough. Some things can wait because they're going to happen and you know it, and knowing it is its own specific form of relief. The formal acknowledgement from Cedar Valley came on a morning in early December in the form of a letter from the hospital's chief nursing officer that was brief and precise and said what it said without excess. It acknowledged Maya's role in the cross-vascular assessment. It acknowledged her identification of the cardiac rhythm change. It noted that her conduct during both incidents had been consistent with the highest standards of clinical care and had resulted in outcomes that the institution considered exemplary. It was not an apology. Institutions are not good at apologies. It was a record. And records, as she'd learned from a long time in environments where records were the only things that survived, matter. Donna gave her the letter at the start of a Tuesday shift, handed it across the nurse's station counter without ceremony, and said, "The CNO left it for you yesterday. Wanted to make sure I gave it to you directly." Maya read it, folded it, put it in her jacket pocket. "Okay," she said. "Okay," Donna agreed, in the tone of a woman who had 22 years of experience and knew that some moments are best met simply. They went to work. She didn't transform. That's the thing about real life that stories sometimes miss. The person on the other side of a significant event is still the person who went through it, marked by it, shaped by it, not remade from scratch. Maya Bennett still apologized too quickly sometimes, Still moved at her own rhythm in rooms where other people expected her to pivot for them. Still took the long route occasionally when the short route passed somewhere she wasn't ready to pass yet. But she stopped making herself invisible. It was a small change in practice and a significant change in fact. She offered clinical observations when she had them, not loudly, not performatively, but directly and without the reflex apology in front of them. She documented thoroughly. She pushed back on Voss when he needed it, and supported him when he needed that too, which was a different thing, and he was learning the difference between the two and becoming a better doctor for it. She answered Marcia's follow-up calls, and she prepared for the tribunal-related interviews with the same thoroughness she brought to everything else. And she stopped treating the act of telling the truth about what she'd done and seen as something that required apology. She had saved a man's arm with her hands and the knowledge those hands carried. She had caught a cardiac event in time because she was paying attention when paying attention cost her something. She had told the truth about a night in a mountain that didn't appear on any civilian map into a record that could not be reordered by the person who'd needed her version of it to be different. Those things were done. They were real. They belonged to her in the way that real things do, not as achievements to display, not as ammunition, just as facts about what she was and what she was capable of, and what she would continue to do as long as her hands worked and her eyes were open, and people needed what she knew how to give. Warren Basque would face his tribunal. It would be long and it would be hard, and the outcome wasn't guaranteed because nothing in the real world is guaranteed. But the charge was filed and the record was built, and the three accounts, Cross, Donovan, and hers, were sitting in official documentation in multiple locations, and the people whose job it was to read those documents were reading them. Justice is not a single moment, it's an accumulation. It is the slow work of people who keep showing up and telling the truth and doing what they know how to do in the rooms where they find themselves, even when nobody asks them to, even when somebody actively instructs them not to. She had been doing that work her whole life. She hadn't stopped doing it when she became Maya Bennett. She had kept doing it, quietly, in ways that looked unremarkable from the outside, until the night a soldier saluted her in a trauma bay, and the work she'd been carrying in silence became visible to a room full of people who hadn't known what they were looking at. They knew now. And here was what she had learned, or relearned, or maybe finally allowed herself to hold without immediately setting back down. Being underestimated is not the same as being small. Being quiet is not the same as being nothing. The people who dismissed her had confused her restraint for limitation, her deliberateness for inexperience, her silence for an absence of something. The absence was never the thing. The thing had been there the entire time, doing its work in the dark, waiting for the room where it was needed. She showed up to every shift. She learned the names of her patients and the specific texture of what each of them needed, and she brought that to her work with a steadiness that was not performance and not exhaustion, and not the residue of guilt she'd been managing for 2 years, but the real thing, the particular quality of someone who has found the place where their capability meets the world's need and decided to stay there. On a Thursday morning in the third week of December, she walked into Cedar Valley through the main entrance. Not the side door she'd been using, the main entrance, through the lobby, past the patient information desk and the winter arrangement on the reception counter and the directory board with its list of departments. And she went upstairs and started her shift. The ward had its morning rhythm. Donna was at the station. Voss was early, which had become a pattern, going over overnight notes with the focus of someone who'd decided to take his education seriously. The monitors ran their quiet commentary from the rooms. Somewhere down the hall, a patient was asking for water. Maya put on her badge. She went to get the water. That was the work. That was all of it, and it was enough. Not because it was small, but because nothing about it actually was.